I'm Daisy Woolham. I'm an infectious diseases and microbiology registrar at the Trust, and I have got one of the Research Accelerator Awards. My background was working on the infectious diseases ward, and we have a lot of patients who inject drugs. We treat for bacterial infections related to injecting behaviours, and it was just really something that came out of working clinically, that we had a lot of really difficult situations on the ward where these patients would have very bad outcomes and very difficult to treat. And it's frustrating for everyone involved, and it's a big problem for the local population. Brighton has a high population of drug and alcohol users and a much higher rate of drug deaths than other parts of the country, including the southeast. And when I started exploring what the evidence base was around things that could be done to improve that, I found there was actually quite a lack of research in that area. And it's often something that's presented as like a kind of like a full stop. So there's just nothing you can do about this patient group because that's just how things are going to be. And so I thought what I'd like to do is sort of try and challenge that and develop some knowledge around ways we can work with the patient group to try and address some of the inequalities in their care and improve their care with bacterial infections. I started my Accelerator Award in March, so I've not been doing it very long. But there's a number of things. So essentially, I'm going to try and put together a PhD proposal during this year. So a lot of what I've been spending my time doing so far is just kind of mapping out the networks that already exist and getting to know the local services and trying to build some relationships with them for what I end up going on to do. I also am going to try and this year do a bit of a sort of review of the epidemiology to get a sense of the scale of the problem at UH Sussex. So I don't think at the moment anyone's looked at the data looking at how many hospital admissions are associated with infections relating to injecting behaviour, and trying to get a sense from that as to how big of a problem it is. And then having a look in terms of the PhD topic, I want to look at the differences in the ways we use antimicrobials in patients who inject and compared to other patients, and see how much of that is based on fact and how much of it is based on fiction. There's also a lot of qualitative things I want to do, so looking at some of the attitudes of prescribers around patients who inject and exploring why they make the decisions of how to treat that they do, and then also working with service users and patients who inject to try and come up with some. I think that's really what's missing in the research, is we don't actually understand. We're going to have all these great clinical trials that will tell us the best ways to treat these patients, but we don't understand how they feel about those treatments. So things like long-acting antimicrobials, oral switch, things like that. It's great if we find out that they work, but if the patients aren't going to take them, then it doesn't really lead to anything. So really trying to centre the patient voice and the patient experience in everything that we do. Yeah, so I've got a great local supervisor who's an academic at BSMS, Bethany Davis, and she's also an infectious diseases consultant. I've also been, there's quite a lot of interest within the Global Health and Infection Department of BSMS in health inequities, so trying to build some links there. There's also the SARIC, which is the Sussex Addiction Research Centre, so we're kind of building some collaborations in. But I've also been chatting to academics from other institutions to try and build kind of the strongest team that we can, and really getting some feedback on what people who've got more experience in this area think are the right avenues to explore. It's very new. It's a real challenge, I think, in terms of I really enjoy doing my clinical work alongside, but it's quite a gear shift every time because I'm doing these split weeks. So I do half the week clinical and then half the week academic time. I think coming from a really fast-paced NHS environment, which is where I've always worked, I've always been a clinician, to kind of the more self-directed sitting and reading papers and thinking is quite different. And I think it's definitely been a bit of an imposter syndrome over the last few weeks. But yeah, starting to feel more confident and feel like I have a clear idea of what I'm doing with my time.